This week, we've been following the work of a Scottish charity in Nepal as it tries to improve access to palliative care, a task which has become all the more necessary following last year's earthquake. Now, EMMS International is conducting a survey to assess how many people in some of the worst affected areas have palliative care needs. Our reporter Susan Ripple travelled to the epicentre of the quake.
Shir Kamari was forced to leave her home following last year's devastating earthquake. The 65-year-old is still waiting for funding to rebuild. She finds it hard to talk about what happened that day.
I was in another house when it hit, and I remembered my family were still at my home. I was worried they were trapped, so I ran as fast as I could to rescue them, but the land was shaking so much I fell. I got back up and I could see my family were outside, safe, but I watched as my house fell down. My heart was sad that my house was gone, but I was thankful my family survived.
Coplang Secondary School here was completely destroyed during the earthquake. Thankfully, it hit on a Saturday, so there were no pupils inside. The building has been so badly damaged, it's now being demolished. It took up to 9 days for relief workers to reach some of the most remote areas. The difficult terrain evident on our drive to what was the epicentre of the quake. Scottish charity EMMS International is trying to assess just how many people still living here have palliative care needs as it works to improve access across the country.
People often spend their entire savings on medical care that's not required or needed to demonstrate their care for their loved ones, and that leaves them destitute at the end of the process. So for us, palliative care isn't just about providing care for those in their final stages, but actually enabling families to care properly for their loved ones, actually without leaving them destitute.
As we've seen this week, the charity has already funded the first specialist palliative care nurse and is working to build a pioneering training centre. But given that this kind of care is still at such an early stage here, it says more needs to be done at a national level.
If somebody suffers, he or she should get access to the pain medicine, psychological support, physical support, social support. This is very basic. This is a human right and a basic need. They need it. And we have to, this is our duty, we have to provide it.
The country has been through so much in recent years, and as it slowly rebuilds, this Scottish charity hopes increased awareness of these basic health rights will mean more people can live comfortably and with dignity. Susan Ripple, STV News, Nepal.